This is a respiratory unit that covers patients that have allergies, asthma, COPD, emphysema, tuberculosis, patients that have nasal congestion, patients that have infections such as pneumonia, sinus infection, upper respiratory infections. Mast cell stabilizer. This is a medication that has an action. It inhibits allergens binding to mast cells from bursting open and releasing substances that cause an inflammatory response within the respiratory tract. The medications that are in this classification are cromolyn sodium, Intol, nasal chrome, netochromol, known as Tyolade. A mast cell stabilizer, it is effective for the management of allergies. Some examples are allergic rhinitis. It is also used for asthma prophylaxis. It's also useful in patients with asthma who have post-exercise bronchial spasms. And the drug should not be used to manage an acute asthma attack, and it is not the treatment for patients who have pneumonia, but it is a preventive medication to be used to prevent an asthma attack. Decongestants. Their action is to reduce the swelling in the nasal membranes. The swelling is reduced and drainage is improved. Some examples of these drugs is Sudafed, phenylephrine, Dimetapp, pseudoephedrine, Afrin nasal spray. Decongestant nasal sprays may have initial nasal stinging sensation. However, with continual use as directed, this does go away. While decongestants do reduce allergy symptoms, but they do not reduce inflammation. Patient teaching about the use of nasal sprays is considered effective self-health management. Sudafed, pseudoephedrine, has been known to cause restlessness. Nasal corticosteroids. The action of this drug classification is that it decreases inflamed airways by preventing mast cells and white blood cells in the respiratory mucosa from releasing histamine, leukotriene, and other mediators of inflammation. Examples of these drugs are fluticasone, known as Flonase, Sensimist, intranasal, triamcinolone, Nasacort. Decreases inflammation of nasal mucous membranes, drying mucous membranes. Fluticasone nasal spray is effective in treating 17 different allergens. Corticosteroids have a side effect of causing hyperglycemia, drying out the oral mucosa, decreasing immune response, and increasing risk of infection in other places within the body as well. Antihistamine, an H1 receptor antagonist, the first generation, diphenhydramine, known as Benadryl. The action of this drug is that it blocks histamine response, decreasing swelling, itching, and congestion. The side effect of this drug is sedation, can also be hypertension and increasing intraocular pressure and urinary retention. Because of the sedative effect, it is important for the patient to understand to avoid consuming alcohol, especially with the first generation antihistamine. Antihistamines, H1 receptor antagonist, blocks histamine response by decreasing swelling, itching, and congestion. They decrease inflammation within the mucous membranes, drying up the secretions that create that drip, that nasal drip. The second generation drug examples are citrazine, known as Zyrtec. That was missing here on the slides, but it is on your drug classification sheets. Fexofenadine, known as Allegra, loratadine, known as Claritin, and levocitrazine, known as Xyzal. These drugs can cause drowsiness, however, they're less likely compared to the first generation. They can cause hypertension as well as increased intraocular pressure. Antihistamines all decrease allergen response. They have a drying effect, therefore they all have a side effect of causing dry mouth. Sulfonamides, the action combination inhibits the metabolism of folic acid in bacteria at 2 different points. Example, trimethoprim, sulfamethoxazole, also known as Septra or Bactrim. This classification of drugs has a side effect of causing crystalluria, which is crystallization inside of the kidneys, bladder, ureters, also known as kidney stones, and hypoglycemia, which is low blood sugar. Antitussives have the actions to stop the cough by blocking the cough reflex. Examples of these drugs are benzonatate, Tessalon pearls, dextromethorphan, Delsum, pentazine with codeine. This is a Schedule 5 drug. The side effects of antitussives, especially the one with codeine, would be drowsiness and constipation. Aminoglycosides inhibit protein synthesis in bacteria in levels of 30S ribosome. Examples of this classification is amikacin, gentamicin, and streptomycin. This classification is also very harsh on the body, resulting or causing ototoxicity and nephrotoxicity. Nursing assessment for the patient is extremely important, not only for monitoring lab work, but also for doing that physical assessment. Fluoroquinolones, the action of this antimicrobial drug, also known as an antibiotic, is that it inhibits bacterial DNA synthesis by inhibiting DNA gyrase. The example of this drug is ciprofloxacin, known as Cipro, levofloxacin, known as Levaquin. Fluoroquinolones are contraindicated to be given along with dairy products and enteral tube feedings because they reduce the absorption of these drugs. Fluoroquinolones have been known to interact with anti-diabetic medications, and these drugs may also contribute to causing photosensitivity in individuals that consume them. These drugs also increase the anticoagulation action of warfarin, also known as Coumadin. Fluoroquinolones should be taken 2 hours before or 4 hours after a multivitamin, mineral, antacid, or an iron medication has been given. Fluoroquinolones have also been linked to contribute to arthropathy, which is that weakening of the tendons. Tuberculosis. The active signs and symptoms are productive cough, bloody sputum, poor appetite, weight loss, night sweats, fever, and chills. Tuberculosis is spread by droplets. The pre-admission assessment, the client with TB would have a culture and sensitivity testing, a complete blood count, family contacts and history, radiographic studies, and a medication history. The initial treatment phase should last for a minimum of 2 months. The continuation treatment phase should last for 4 to 7 months. A prophylactic treatment should be given 6 to 9 months. Anti-tuberculosis agents, rifampin, known as Rifadin, isoniazid, known as INH, pyrazonamide, and ethambutol, known as myabutol. Rifadin has side effects causing discoloration of the body fluids that turn red-orange, the urine, sweat, and tears. It also causes vertigo, known as dizziness, nausea, and sometimes a rash may appear. INH, isoniazid, is used to treat tuberculosis. It causes side effects of peripheral neuropathy and has caused hepatitis as well before. Tuberculosis drug-resistant organisms, clients who have no response to therapy, or clients who have been treated in the past. Active tuberculosis treatment with anti-tubercular drugs are classified as primary or secondary agents to describe the way they are used in treating tuberculosis. The combination of drugs helps to slow the development of bacterial resistance in active TB. Secondary drug to treatment of tuberculosis are less effective than primary drugs. Secondary tuberculosis drugs are used to treat drug-resistant TB. For patients receiving parenteral treatment for tuberculosis, we need to make sure to rotate the injection sites. The Z-track method. Inject the penicillin using the Z-track method. Aspirate before injecting the drug. Aspiration is not recommended for IM injections of vaccines or immunizations. If aspiration is required for a certain drug, pull back the plunger after inserting the needle and check for the presence of blood being drawn into the syringe. If this occurs, remove the needle and discard the drug and the syringe properly. You will then need to prepare a new dose of the drug and inject it into a different site. Mucolytics. The action, it loosens or breaks up thick mucus. Guaifenesin, Mucinex. Mucolytics break up mucus, allowing a client or patient to effectively expel phlegm. The frequent coughing can result into bronchial spasms. Children between the age of 2 and 6 have been reported into cases of having overdose in consuming mucolytics. The FDA has a recommendation that these children of the ages of 2 to 6 not receive mucolytics. Status emeticus is an acute, prolonged, severe asthma attack that is unresponsive to usual treatment. Typically, the child requires hospitalization for the treatment. An inhaler or an MDI or a nebulizer is used by a patient, and patient teaching needs to be done. The patient or the client needs to sit upright, and the inhaler needs to be held upright. The client needs to wait 1 to 2 minutes between puffs if it is an MDI. The mouth is rinsed with water following any administration. The client should also be instructed to hold his or her breath for at least 10 to 15 seconds before exhaling the mist of any inhaled dose of medication. If the patient has 2 different types of inhalers to use, there should be a 5-minute wait between one medication and the use of a second medication. Short-acting beta-2 adrenergic agonist known as SABA. The action rapidly binds to beta-2 adrenergic receptors in bronchial smooth muscle of airway, causing the smooth muscle relaxation. The drug examples are albuterol, known as Ventolin, levobuterol, known as Xopenex, pyrbuterol, known as Maxair. SABAs are bronchial dilators, and they do relax the bronchial smooth muscle. If shortness of breath is not relieved by a multi-dose inhaler, call the healthcare provider. Prevention or relief of a bronchial spasm. The side effects of using this drug is feeling of nervousness, dizziness, hypertension, and it could be that a patient may experience a headache as well. SABAs are rescue drugs. They are effective in stopping an asthma attack or a bronchial spasm. Most important to know about beta-2 adrenergic agonist is to teach the patients with asthma to always have their short-acting beta-2 adrenergic agonist reliever drug with them at all times, because an attack can occur anywhere and only a SABA can work fast enough to prevent a severe attack and death. The beta-2 adrenergic agonists have actions that are similar to the sympathetic division of the autonomic nervous system. When these drugs are used heavily, they can have systemic effects, which include rapid heart rate, tremors, increased blood pressure, and a feeling of nervousness, difficulty sleeping. The inhaled drug can dry the mouth and the throat and may leave a very bad taste within the mouth. The long-acting beta-2 adrenergic agonist, known as LABAs. The action is that it binds to the beta-2 receptors in smooth muscle of airway, causing smooth muscle relaxation. Example is salmeterol, known as Ceravent. Long-acting beta-2 adrenergic agonists work in the same way as SABAs, but need time to build up an effect. Therefore, LABAs are used to prevent an asthma attack because their effects last longer but have no value during an acute asthma attack. Inhaled corticosteroids. The action is that they decrease inflamed airways by preventing mast cells and white blood cells in the respirator mucosa from releasing histamines and leukotriene. Examples of these drugs are beclomethasone, also known as QVAR, budesonide, known as Pulmicort, and fluticasone, known as Flovent. When using a SABA and an inhaled corticosteroid together, always use the SABA first. An anticholinergic bronchial dilator. The action of this classification is that it dilates the bronchi. It inhibits the cholinergic receptors of the bronchial smooth muscle. Example of the drugs are ipratropium bromide, known as Atrovent, and tiotropium, which is Spiriva, Handihaler, or Respimat. Antifungals. The action of this drug classification is that it binds to fungal cell membranes, allowing leakage of cellular contents. Examples of this drug is biostatin, known as nystatin. It's an oral liquid to swish and spit or swallow. Fluconazole, known as diflucan, is an IV or PO medication. Diflucan or fluconazole can be a medication that is used for treatment of systemic fungal infections. Systemic refers to infections that flow through the entire bloodstream of the body. Why biostatin, also known as nystatin, is known to treat oral thrush. Fluconazole, also known as diflucan, is also used to treat oral thrush as well. Yeast and fungal growth occur from antibiotics upsetting the normal balance of the body's normal flora. Yeast and fungus also like to grow in warm, moist, dark places. So when MDI and nebulizers are used and oral care is not provided to patients after their use, fungal infections and yeast infections can also occur in the mouth, as well as they can in the colon and in the vagina. Microlides. The actions It inhibits the protein synthesis at the level of the 50S bacterial ribosome. Example of this drug classification is erythromycin, also known as EES granules, clarithromycin, known as Biaxin, azithromycin, known as Zithromax, or also known as Z-Pak. This classification of drugs treats gram-positive and gram-negative bacteria. The classification of microlides, the erythromycins, the clarithromycins, azithromycin, these drugs are very commonly used to treat upper respiratory infections, known as URIs. The expected outcomes of treating these patients are that they would have a decrease in their symptoms, such as decreased nasal obstruction or decreased nasal discharge, decrease in their coughing, and an overall improvement of their symptoms, whatever they may be. Cephalosporins have about 4-generation medications here. So the first generation is particularly used for patients that have an allergy to penicillin. Cefazolin, cephalexin, known as Keflex. The second generation is used to treat nosocomial pneumonia. Cefaclor, cefuroxime, known as Ceftin. Your third generation, cefdinir, Ominence, ceftriaxone, and then your fourth generation, cefepime, known as Maxipine. Most of your cephalosporin drugs have a Ceph, a CEPH, or a CEF, or a KEF in their names. The cephalosporins are known to treat gram-positive bacteria. With antibiotics, they are part of that A pinch. They have a higher alert for patients to have an allergic reaction. So it is a higher level of concern that patients would have hives, rash, dyspnea, angioedema, itching after any administration of these drugs, especially after a first dose administration. Vancomycin inhibits the protein synthesis in bacteria at a level of 30S ribosome. An example of this drug is referred to as vancomycin, also known as vanicin. Vancomycin is a very harsh drug. It is nephrotoxic, which means it's very harsh on the kidneys, and is hepatotoxic, which means that it's very hard on the liver. There is a peak and trough level as far as the labs. However, there is primarily a trough lab level that is monitored versus the peak, and that level runs between 5 and 15 micrograms per milliliter. If the lab value is close to 15 or over 15, the vancomycin antibiotic piggyback will not be hung for the patient, because if it is given or administered to the patient with the lab value already being so close to 15 or at 15, after administering this medication, it will push that lab value above that high normal. So we always want to know what that lab value is before we administer the vancomycin medication. Once this medication is in that patient's system, if we push them to that toxic level, it can cause a lot of irreversible damage to their kidneys, to their liver, and to their ears. That is irreversible. We have vitamins A, B, C, D, E, and K. There's an acronym. Katie is fat. K-A-D-E. Katie is fat. The vitamins K, A, D, E stand for fat-soluble vitamins. So the only vitamins that you have left that are not mentioned are vitamin B and vitamin C. Those vitamins are, of course, your water-soluble vitamins. So your water-soluble vitamins are vitamins that are actually excreted out of your body a lot faster than your fat-soluble vitamins.